Okay, well, hi everyone. My name is Holly, and I help run the Student and Scholar Health Insurance Program, which is known as SHIP. So we are going to talk today about that. And if you guys have any questions, feel free to put them in the chat, and I will make sure to take some breaks to address the questions and get you your answers. So today we're going to talk about the ISU Graduate Assistant Benefits, what's provided to you, how to enroll, if you haven't already, and what health insurance is, where and when to use it, how it works, as well as the dental insurance. And then we're going to talk a little bit about insurance first. So to kick off, as a graduate assistant, you are provided with self-only medical coverage as a benefit of your assistantship. What that means is that the university pays for your self-only premium for the duration of your assistantship. You may enroll your spouse or domestic partner and dependent children at an additional cost to you, and dependents must be added within 31 days of your hire or a qualifying event. And any dependents accompanying international students must be enrolled in the ISU student health insurance within 31 days. I think that got cut off there. We are in open enrollment right now, and the open enrollment started July 1st, and it runs through September 30th. So with these added within 31 days, just make sure that you get your benefits set the way they need to be by September 30th. After that, you would need a qualifying event to make any changes on your medical or dental. Okay, so here are the medical plan costs for this academic year, 2021-22. You can see on the first line here, if you have self-only coverage, the total monthly premium is $212, and the university pays for that total amount. So there is zero monthly cost to you. If you were to add dependents, so let's say you have a spouse or domestic partner, the rate does go up. The department will contribute a portion. Your amount would be $193. If it's just you and children, so no spouse or domestic partner, that is the rate for this line. And then if you do have a family, so a spouse or domestic partner and children, you can see the rate on the bottom line. So you can see that the self-only is covered in each one of these scenarios. It's just that when you add dependents, that is a cost to you. As far as dental, graduate assistants are, actually, let's backtrack. I'm gonna ask if there's any questions about the medical right now. I did see one come through. Is it possible to enroll in guest coverage for the health insurance to get covered in another city? Yes. So we have something called guest membership. And if you are going to be outside of the state of Iowa for 90 days or more, then you can apply for something called guest membership. You apply for it through Wellmark, which is our insurance provider. And then they are able to find you providers in the area you will be at a lower cost than they would be if you were considered out of network. So you get out of network providers at an in-network cost so that they are cheaper for you to use. The information on how to do that is actually on our website. I'm going to put the website in the chat. Or if you have questions, you can actually email me at isuship@iastate.edu. While I'm talking about the email, we are at an influx of crazy amounts of phone calls and requests right now. It is easiest to get a hold of us through email, but we are taking about 3 to 5 days to respond. So if you do send us an email, don't get scared if we don't respond to you right away. We are getting to all of them. It's just taking a while. We've got 23,000 students coming back this year, so we've got lots of questions to answer. Okay. I will go on and talk to dental a little bit. So graduate assistants are eligible to receive a portion of the self-only dental insurance as a paid benefit of your position. So the university does not provide full dental, they provide a portion of it. And you may enroll your spouse or domestic partner and child dependents at an additional cost to you. And the dental coverage is not mandatory, so you are never automatically enrolled in it. It is something that you would need to let us know or sign up for. And the costs are right here. So it costs $21.50 for the self-only premium. ISU will pay $13 of that. So the remaining cost to you would be $8.50. And then again, it breaks down if you've got a spouse or domestic partner. You are yourself and children, and then if you have a family. On the family note, it doesn't matter if you have one child or 6 children, the rate would be the same. That's both for medical and dental costs. Okay, so we've gone over a little bit of the benefits. We can go into that a little bit more, but I really want to talk about how you enroll, because this is brand new for us this year. We just got done integrating all of our graduate assistants into Workday to be able to view and monitor your benefits. So you should, if you have not already, received a to-do in your Workday allowing you to choose your benefits. I want to edit this that if you were a previous graduate assistant in the summer or the spring or even last fall, and you are not being hired on for a new assistantship, this doesn't exactly apply to you. We actually took the benefits that you were enrolled in for last plan year and put them into Workday. So if you are one of those graduate assistants and you went through the Blues Enroll open enrollment, you might want to shoot us an email so that we can verify that your benefits were transferred correctly, and if you chose dental and didn't have it last year, that we got that put in Workday for you. And again, a reminder, medical for self-only coverage is required for your assistantship unless you have an approved waiver. And we'll talk about approved waivers towards the end here. The premiums beyond self-only medical coverage will be deducted from your monthly pay. So let's say you enroll your spouse or your domestic partner. You're going to have a little bit of a premium to pay for the medical coverage / and or dental. So that amount, it does not go to your U-bill. It's deducted from your monthly pay. So it comes out of payroll. This would be medical coverage for any dependents and dental premiums for self-only or dependents. So if you choose dental and you have self-only coverage, that $8.50, that will come out of your paycheck. And then you can find the following job aid on our website. Don't really want to click in here, but I'll see if it'll take you guys. Okay, so this is our enroll now. I'm going to put this in our chat. This is our enroll now page. So this is where you can find information on how to enroll, what to do. It gives you a little bit of a guide that I will go through as well. Figure out how to go back to my screen. But you can see right here as a graduate assistant, this is the one you would want to pay attention to. You do not want to use Blues Enroll as a graduate assistant. Don't even worry about Blues Enroll portal anymore. If you've used it in the past, you're not going to use that anymore as a graduate assistant. If you were to stop being a graduate assistant and go back to an undergrad grad student only without an assistantship, you'd want to worry about Blues Enroll, but not for this case. Okay. Here we go. So completing your benefit enrollment before you enroll in benefits as a new hire, review information about your benefit options, and then for more information on the Student and Scholar Health Insurance Program, you can just go to that website that we were just on. So this is a screenshot from Workday. I'm going to kind of zoom through some of these because it is pretty self-explanatory. But you want to make sure that you're going to your own Workday and that you are clicking into your inbox to find your to-dos. And then it'll have an icon down there for you to get started. And then it'll go through and give you the option to make changes to your medical. And then it'll go through dental next. And again, this entire guide is on our website, so you can look through it more slowly if you would like to. The biggest thing is you want to make sure you're choosing the correct type of coverage. So whether it's yourself only, yourself and children, yourself and spouse, you want to make sure you click that correctly. And if you do choose one that has a dependent, it will ask for dependent information on this screen. You would just put everything that has a red asterisk, click save, and then it makes you go on to the Delta Dental. So if you do not want dental, you would just click wave down here. But we put it in the assumption that everyone would want dental. So in that case, you would hit select. And it goes through the same kind of thing. You choose the type of coverage you want, and then you go ahead and verify and submit. And then it will give you a breakdown so you can see it. And then it will let you know that your enrollment is complete. So after you are enrolled, it takes approximately 7 to 10 days for you to receive your ID cards. And your card is going to have your name, insurance plan information, and this is what you would need to take with you when you go to see the doctor or the dentist. If you need to use your insurance and you do not have your card yet, don't panic. Just give our office a call or an email in this case, and we'll provide you with a temporary card. We actually give you an electronic version of your card. It's not really temporary. You can use that for the remainder of time that you're on the plan. And it can replace basically the one that's mailed to you. Okay, I saw a question pop up, so I'm gonna check that really quick. I'm in my second year as a grad student. Just to confirm, we don't have to do anything on Workday to be enrolled in the health insurance. I want you to check your Workday. When you go into Workday, you are able to view your benefits. Make sure that you have what you intended to have for the year. If for some reason you were hoping to add dental and you don't see dental on Workday, then email us so that we can get that fixed for you. Normally, when we get everything perfected with the Workday graduate assistantship, you shouldn't have to worry about that too much. But for right now, we want everybody to double check their benefits just to make sure that we've got you in what you want, because we've still got a month to make any changes if needed. And somebody asked, how can we see the benefits? Let me see if I can show you this really quick without showing you any personal information. Let's go to, let's go to me. I don't care if you guys see my benefits. Okay, so when you get into your profile, it's going to have all this information here. It'll have your university ID right up here. It'll have your assistantship position. And then over here on the left in the blue column, you should see benefits. You're going to click on benefits, and then it tells you what benefits you have. So I have a lot more than you guys have as an assistant, but you want to look at the top two. You'll see your medical first, and then you'll see your dental. If you don't see dental and you thought you had dental, then you need to reach out to us. If something looks strange with your medical, reach out to us. This column here will show who is covered. So make sure that it is what it should be. If you've got a spouse and it says yourself only, reach out to us because we need to get something fixed. Okay. Keep coming with the questions. These are good questions, you guys. Okay, so let's talk about where you can use your health insurance. As a graduate assistant, you're all still students as well. So we highly recommend that you go to the Thielen Student Health Center first. And that is because most of their services are free or an extremely low cost. You sometimes don't have to worry about paying a copay. Sometimes they don't even charge you for a type of visit. And you can get a lot of services there just for free. So we always recommend going to TLIN first. If it's something that is above and beyond what they can help you with, or if they are closed, you can go to the McFarland clinics around Ames or Mary Greeley Medical Center, which is the hospital and emergency room. There's also primary health care locations. And we do have other locations nationwide if you're going to be outside of the state of Iowa. With Mary Greeley Medical Center, the hospital and emergency room, only use those if it is a true emergency. Hospital bills and emergency room bills are super expensive. And if you can prevent having a large cost to yourself, you should. So always go to TLIN unless it is a true emergency. And it does matter where you go, like I've just talked about. You'll face different costs depending on where you go to receive your care. TLIN is going to be generally 100% covered. If you go to a McFarland clinic, Mary Greeley, primary health care, you'll have to pay more for care, and they will also bill you directly instead of TLIN. Okay, so we've got some examples in here of what you should do / not do. So if you've got a common cold and you go to the TLIN Health Center, let me rephrase that. If you've got a common cold, you should go to the TLIN Health Center. With something simple as a cold, they are going to help you. You may only have to pay $10 if they give you a prescription, but a cold, you usually don't even get a prescription. They just try to help make you feel a little bit better. If you were to go somewhere else for that same issue, you'd have to pay a copay. The doctor would bill you for his charges and time. And if you got prescribed something, the prescription could be sometimes $20, $30. So just keep in mind, if it's not a very major thing, TLIN's going to be the place to go. If you went to the McFarland clinic with a cold, I kind of just went over this, but you could have a $10 copay for medications. You also have a $450 deductible for services beyond the TLIN Student Health Center. So you're going to be responsible for paying the costs up to $450 each plan year. So we just started a new plan year. So everybody starts at zero. You have to pay up to $450 before the insurance is going to cover the majority of costs for you. Excuse me. Okay, example number 3. If you got into a car accident and needed a surgery, I hope this doesn't happen to any one of you. But if you get into a car accident, you're going to have to go to the emergency room. It's located at Mary Greeley. And let's say you're totally fine, but you have some stomach pain, and the doctor says you need to have your appendix removed. So since you're visiting the emergency room, you're going to have a $100 copay. However, if you're admitted for surgery, and that $100 copay can be removed if you notify the insurance company within 24 hours. And surgeries are expensive, so you're going to have your deductible, you're probably going to reach your deductible of $450. And then the coinsurance with the visit to the hospital. So let's just, for example, say that the total cost is $10,000. This gives you a breakdown of what you could expect to pay. So the total amount, $10,000, $450 is your copay. And then since excuse me, I'm so sorry, $450 is your deductible. So you pay $450, and then insurance is going to cover 80% of the cost, and you will be responsible for 20% of the remaining cost. So your share with the $450 deductible and the 20% remaining is going to equal $2,360. Now, let's say you got into the same car accident, but it was outside of the state of Iowa. Again, since you're visiting the emergency room, there's going to be a $100 copay. But if you're admitted for surgery, that $100 copay is removed if you let the insurance know within 24 hours. And then for this example, we are saying again that it's going to be $10,000. But because you're out of the state of Iowa, you're not considered to be seeing an in-network provider. So the costs are going to be more expensive for you. Your deductible is $600 if you are visiting an out-of-network provider. That's your deductible, $600. And then your 20% jumps up to $3,760. So your total share that you'll have to pay is $4,100. Okay, after receiving care, you can expect to receive an explanation of benefits, which we call an EOB from Wellmark. It is not a bill, and it'll say on the top, it's not a bill. The explanation of benefits simply provides a snapshot of the services that you received, how much the overall costs are, how much the insurance is going to pay, and then how much you can expect the bill to be. And then you will later receive the bill from the doctor's office. If you receive care similar to example 2, 3, or 4, you'll receive an actual bill from the provider. And it may take several weeks to receive the bill, and sometimes you might receive duplicate bills. If you believe that there is an error with your bill, you want to reach out to the provider where you received your care. Okay, let's look at some questions really quick. Oh, I'm sorry, you guys couldn't see the benefit screen. I apologize for that. I'll try to do that again. How do we schedule time to go to the health center? With Teelan Student Health Center, you can actually call them and schedule an appointment, or they do allow drop-ins as well. Is there a recommended place for yearly checkups? Yeah, Teelan Health Center. They can take care of your yearly physicals. They also provide women's services for women's health as well. So you can always go to Teelan. If you want to go off campus, then you can choose from McFarland's or Primary Healthcare or Mary Greeley. And then there's a question about FMLA. I'm not going to get into FMLA because I don't deal that much with FMLA. If you need more information about FMLA, I would contact your manager. They're going to be the best person to reach out to help. It is a human resource issue, but it is not one that I directly deal with. So I'm not going to speak to that today. But let me try and get you guys. I want to try to show you. Here we go. Okay, feel free to respond in the chat. Can you see my Workday screen right now? Okay, somebody said yes, thank you. Okay, so this is me. This is my stuff. So when you go into Workday, click on the cloud over here. It says profile, and it'll bring you to your page. And then it should have your information as far as like your university ID and your title. And then over on the left in the blue column, you want to go down to benefits. And then this is where your benefits should be listed out. I have a lot more than you guys do. So you want to pay attention. You'll have 2 lines where it says medical and dental. So make sure that you have the coverages in there that you should have. So if you're supposed to have both of them, make sure they're both there. And then also check the coverage column and make sure that it has the correct type of coverage. So mine is self-only. If you have a spouse that should be on your policy, make sure it says self and spouse, that sort of thing. Does that make it a little bit easier and more clear for everyone? I'm going to take that as a yes, unless somebody says something in the chat really quick. Okay, sorry about that before. Let's go back to PowerPoint. Okay, can you all see my PowerPoint now? Thank you, Kendra. Very responsive. Okay, so we're going to talk about dental next. We have our insurance provided by Delta Dental of Iowa, and it is voluntary for all eligible students. The enrollment period is per academic year. So it's for a full 12 months. It runs this is not quite right. That should say August 1st to September. Nope. That's open enrollment period. I apologize. So the open enrollment period for dental is the same as the health coverage, but the total coverage amount is for a full 12 months. So it runs August 1st through July 31st. You are unable to drop your coverage once you are enrolled, even for a qualifying event. So if dental is something that you're wanting to add, make sure that it is something you want to have on there, or that you do not want it, because you cannot join dental with a qualifying event either. The only reason we would drop dental is if your assistantship ended. We would allow you to remove the dental. Where to use your dental insurance. So Teelan Student Health Center unfortunately does not provide dental services. So you would need to find a dentist in the Ames area. We do have a tool on our website where you can find a provider. And most dentists in Iowa take Delta Dental because it is an Iowa-based company. But you should still use the tool to find a dentist near you. Or if you have been referred to a dentist, you can call their office and ask them if they take your policy. Most of them do, but just to make sure. And then let's talk about services that Delta Dental covers, because there are some that they don't cover. So every year you get 2 routine exam and cleanings, and then you would pay 20% of the cost for fillings, extractions, or sealants, and 50% of the cost for root canals or gum disease type issues. You do have an annual maximum benefit of $600. What that means is that Delta Dental will pay $600 of your yearly dental fees. So even though under the routine exam and cleaning, you can see that little bullet point, even though you don't pay for the 2 exams, they do count towards your annual maximum benefit. So let's say each visit for a routine cleaning is $150. I'm just pulling that number out of the air. So let's say you go to 2 of them per year, that's $300. That does go towards your $600. So you've used half of your annual maximum benefit. Important to know that the following are not covered. So you cannot use your insurance towards wisdom tooth removal, orthodontics, or TMJ expenses. I always get a lot of questions on what TMJ is. That's when you have a really sore jaw. It can be from grinding your teeth or multiple things, but where your jaw is very sore and you can't move it very easily. Okay, before we get into this part, I saw a lot of questions pop through. So let me go back and check. So how do you add dental insurance? Okay, so you will, if you don't already have dental and you want dental, reach out to our email. I'll put it up here again with your student ID number and, oh, sorry. Reach out to us via email with your student ID number. Let us know that you want to add dental, and if it's going to be for self only or if you have dependents that need to be added onto it, and then we will put it in manually for you. We'll also send you a confirmation, and then you can go out and check your benefits tab in Workday and make sure it's correct. Is there guest coverage available for dental too? I believe that it's only for the guest membership coverage is only for health. Delta Dental is an Iowa-based company. I am not sure that their coverage extends past the state of Iowa. I will check on that though. I think that was whoever sent me that question. Will you email us that question as well? Because I will look into that and let you know. A lot of questions of how to sign up. Just email us, give us your, whenever you guys email us, give us your student ID number and let us know that you want to add dental. And if it's for self only or self and spouse, self and domestic partner, self and children, just let us know the coverage. And then we'll get it added for you. Okay, so let's talk about those individuals who have their own health insurance. You would want to check out the health insurance waiver process. The following international students may be eligible to waive the ISU student insurance. I want you to really focus on those words, may be eligible to waive. We do not allow waivers for everyone, so you do need to meet the requirements that are listed here. If you're sponsored by your home government and they're providing you their insurance, if you're an approved exchange student with insurance through your home university, if you're a student who's being sponsored by an approved US or international organization such as Fulbright, you have a visa other than J1, F1, J2, or F2. So for example, if you hold an H1B, an H4, or an L2, and then students who have been approved for OPT and have their own insurance through their employer. Domestic graduate assistants can waive the ISU student health insurance if you are an eligible dependent covered by your parents' health insurance and under the age of 26, covered by your own employer-sponsored health insurance, covered by a spouse or partner's health insurance, or eligible for Medicaid or individual coverage through the federal marketplace. If you believe that you fit one of these requirements and you would like to apply for a waiver, visit our website here. I'll click on it. Hopefully you guys can see it. Oh, it's not going to let me click. I apologize. Go to our website, which I had posted in the chat, and click on the waiver tab. It will have all this information. Oh, and I apologize. We've already gone over, or no, we're at a half hour. So I will show you the website really quick. Okay. So this is our website. And then if you click on waive, this is where you'll get all the waiver instructions. So this is what I just read to you guys. And then there's, you can print out the waiver instructions, or there's the waiver form, and then information on how to complete the waiver. And then it's got some frequently asked questions with answers down here. So you guys can check that out as well. And then once you complete the waiver, you just want to return it to us. If you guys are running into issues and you need help, you want to contact the SHIP office, which is in the benefits office. We are located at Beardshire Hall, 3810 Beardshire Hall, which is where most of you came to sign your I-9s. We always recommend a phone call or an email if it's a complicated situation, because there is often paperwork that is necessary for you to bring with you regarding fixing whatever is going on. So always email or call, and our phone number is on there. It will route you through the service center. And sometimes if it's an easy enough question, they can help you before it comes to me. If it's really complicated, they'll move it on to me and I'll answer it for you. I am the individual who works on SHIP year round. And then during this time of year when it's really busy, we have some individuals from the benefits office jump in and help. So at this time of year, it's not always me answering your question, but throughout the rest of the year, it would be me. And then if you need information on Teelan Student Health Center, this is their address and phone number and website. I encourage you guys to become familiar with it because, like I said, they're the best place to go if you need to receive any care. Excuse me. And then this is our contact information for our insurance providers, Wellmark, who does our medical insurance, and Delta Dental, who does the dental insurance. If you guys ever have questions about why something wasn't paid in full or why a coverage issue, we would most likely have you reach out to the insurance company directly because that's above and beyond what we can help you with. Okay. Do we have any more questions? Still got quite a bit of time. I went through that a lot faster than I thought I would. So if I spoke too fast or if anybody has questions, please let us know in the chat box. Or if you don't feel comfortable putting it in the chat box for everyone to see, email me at isuship.iastate.edu. Remember to include your university ID number, the best way for us to pull up your information fast. If anything does not look correct in Workday, reach out to us. If you don't think you've signed up for benefits in Workday, reach out to us. I will just wait to see if there's any questions that come through.
There was a question that just came through about whether or not they're offered any sick days.
Oh, I don't have that information. You would have to ask your manager about that. And then there is one more thing I just thought of to mention. How do I explain this? Some graduate assistants, you were charged on your U bill before you became a graduate assistant. So we started billing for the semester on July 30th. And for most of you, your assistantships did not start until the middle of August. So everyone should be in the habit of checking your U bill. But if you see a charge on there for health insurance or dental insurance, reach out to us via email and we will take a look at that. And if you have been coded correctly as a GA, we can get that refunded for you. I think that's been about the biggest issue that we've seen with the integration. But yeah, we're excited for you guys to be able to use Workday because in the past, graduate assistants were not even aware that they had benefits, which is unfortunate because it's free medical health insurance. And everyone knows that medical care in America is very expensive, but health insurance can also be pretty costly. So if I had the opportunity to have a job with free medical insurance, I would definitely take it. Okay, I don't see any more questions, but I will still hang out and wait if you guys have any more. I'm getting a lot of thank yous. You're welcome, you guys. I hope I didn't speak too fast. I've been doing quite a few of these, so I feel sometimes like I turn into a robot.
Well, it looks like there's another question in the chat too.
How do we follow up if we took a loan? I'm not quite sure. I'm not quite sure about that question. If you can expand on that, about the loan question. I think you might mean if you were billed for medical or dental and took out a loan. You're wondering if the loan covered a portion of the medical or dental. In that case, we would credit back the U-bill. I'm not sure how that would impact the loan. I believe if it was an Iowa State funded loan, they would eventually get that amount back. If it was a federal loan that was dispersed to you, I believe that the amount of money would go back to you. But you might want to email me or email ISU SHIP so that we can look at your situation specifically and find out where the funding is going to go back to. I can get accounts receivable involved and we can take a look at that. All right, guys. Well, if you don't have any more questions, I can give you 15 minutes back to your day. And I'll leave you with email us if you have any questions or concerns or anything, and we will figure it out with you and help you, and we'll get through it. Sarah, do you have anything else for me?
I do not. Thank you so much for doing this.
Yeah, of course. Let me know if
Yeah.
you need me to do any more.
Yeah, this is very informative.
Great. All right. Well, I hope you guys all have a great day and that I'll see you around campus.
Yeah. Have a good day, everyone.